Hello, my name is Melissa Hasek, and for my presentation, I decided to do dissociative identity disorder. I chose this topic because it was interesting to me and I wanted to learn more, so I thought it'd be a good teacher professor moment. I felt like this addressed the psychological disorder portion of the SLO. On this slide, you can see my references. The dissociative identity disorder at the top, that was the reference for my picture in the next slide. But I mainly used NAMI, National Alliance on Medical Illnesses, and the American Psychiatric Association. I believe all my references are very scientific because they're all backed up by other sources that are well studied and by professionals such as Philip Wang with an MD, Dr. PhD, and in this slide I will be talking about what is dissociative identity disorder and what are the symptoms. So what is dissociative identity disorder really? Well, it's a person's identity split into two or more personalities. And by they I mean the personalities that the person exhibits, become present involuntarily in the individual. Side note, dissociative identity disorder, or DID, is more commonly known as multiple personality disorder. So, an individual with DID often has distinct personality states, and this just means the person has different personalities that are also often called alternate personalities or alters. About 2% of people experience DID, and it's mainly women who are diagnosed with DID. What are some of the symptoms of DID? Reoccurring periods of amnesia, recurrent lapses in time, identity confusion, and experience of possession. There are also secondary characteristics such as alters intruding into awareness, distress, or impaired function. The chart next to the symptoms is taken from the traumadissociation.com, and it is mainly the 5 components of dissociative disorders, which are amnesia, identity confusion, and alteration. Then depersonalization, which means the individual has feelings of detachment from actions, feelings, thoughts, and sensations. For example, as if they were watching a movie. Then you have derealization. It is related to depersonalization. It just means the person feels like everything around them is unreal. There are also tests that I saw on the American Psychiatric Association. And they said that there are many tests that can be run, but one of them that I looked up was called Dissociative Experiences Scale, DES, and it is a questionnaire that is useful for identifying if you have DID, and it mainly asks questions about your daily life and the experiences that you notice. In this slide, I'm going to be talking about the causes and treatments. So, what are the causes of DID? They are overwhelming experiences, traumatic events, abuse occurring in childhood, and mainly the trauma is formed when you're a child, and it's from long-term sexual, physical, or emotional abuse. The treatments for DID are psychotherapy, and there are 2 psychotherapies that can be used, such as cognitive behavioral therapy, CBT, or dialectical behavioral therapy, DBT. You can also take medications such as antidepressants, but really there is no known cure for DID. This is the quick quiz. So, what percent of people experience dissociative identity disorder? A, 1.5%, B, 3%, C, 2%, or D, 5%. 2% is the answer.